The Beginner's Guide to Irritable Bowel Syndrome. Are you suffering with discomfort, irritation, and pain of IBS? This condition affects around 20% of the American population, most of them women. IBS is a type of bowel dysfunction that causes a variety of symptoms and problems, including diarrhea, constipation, nausea, vomiting, bloating or cramping, abdominal pain, painful bowel movements, stools with undigested food particles, feelings of incomplete defecation, even mood conditions like anxiety, depression, loss of appetite, poor food absorption, fatigue, headache, and bad breath. You may experience some or all of these symptoms at the same time or at different times. What's important is that if you have IBS, you seek out a professional immediately. Some unexpected causes of IBS. The main cause of IBS is still unknown, but there are several factors that do seem to trigger and contribute to the development of IBS, including chronic stress, chronic infections, antibiotic use, GI infections, immune system malfunctions, certain medications, like I said, antibiotics and other medications as well, changes in hormone levels or hormone imbalances, mood disorders, anxiety, depression, and brain chemical imbalances, particularly serotonin. So if you have an imbalance and symptoms of IBS, make sure you're looking at your lifestyle for triggers and then talk to your doctor about testing for IBS. How your doctor diagnoses IBS. IBS symptoms come and go, and that's very frequent and common, but it can be both debilitating and embarrassing as well. IBS, irritable bowel syndrome, should be suspected in patients who have chronic abdominal pain, alternating constipation, and diarrhea as well. A clinical diagnosis of IBS requires the fulfillment of a symptom-based diagnostic criteria, as well as a limited evaluation to exclude other underlying organic diseases. And so this is IBS is defined as recurrent abdominal pain on average at least 1 day per week in the last 3 months, associated with two or more of the following criteria: related to defecation, associated with a change in stool frequency. Number three, associated with a change in stool form, which is the appearance. And so here are some tests that your doctors may order if they suspect that you have IBS in order to rule out other disease processes. Blood tests to rule out other conditions, stool samples to rule out infections, a colonoscopy, and food allergy tests to test for allergies or food sensitivities. These tests may be invasive. However, they're an essential step in identifying the underlying problem of what's going on in your body and what can be done about it. The link between adrenal fatigue and IBS. Adrenal fatigue is caused by chronic stress, often physical stress that's caused by poor toxins, diet, recurrent infections, overuse of medications, antibiotics, and excessive alcohol consumption. Now, when you're stressed for over a long period of time, your body works overtime to produce cortisol. And high cortisol can cause the gut to be more leaky as your gut tight junctions begin to leak. High cortisol then will allow more toxins to also penetrate your gut lining. As your gut has many immune cells, it recognizes these toxins that are leaking through and also starts to attack them. And so gastrointestinal disruptions are a common symptom of adrenal fatigue, as well as other issues such as food sensitivities and drug sensitivities. A lot of people start saying, I keep noticing that I have more and more food sensitivities. So then this can lead to increased bowel irritation, digestive issues, and can compound all the other issues that's going on already. So adrenal fatigue also causes rampant inflammation throughout the body, and inflammation is a key contributor to IBS as well as other chronic health conditions. Lifestyle changes that can help manage the symptoms of IBS. Addressing and alleviating the symptoms of IBS can help improve the quality of your life as well as your health. So it's very important to get to the root cause of what might be causing it. Here are some ways that you can do to start improving IBS symptoms. Adopt strategies that will reduce your stress levels. Eat a balanced diet that's free of sugar, processed foods, caffeine, and hydrogenated oils. Low FODMAP diet can be helpful in some circumstances. Also, exclusion of gas-producing foods. Patients with IBS should be advised to exclude foods that increase flatulence, such as beans, onions, celery, carrots, raisins, bananas, apricots, prunes, Brussels sprouts, wheat germ, pretzels, and bagels, along with alcohol and caffeine. I know that's a long list of foods, but avoid some of them that can help. These short chain carbohydrates are also poorly absorbed, and so that's why they can lead to more bloating. So that's why the low FODMAP diet can help. Fiber in those who have IBS constipation can help. Moderate exercise every day. Work on thinking positivity, and then talk about your doctor about supplements and natural medications that might help. And make sure you can also aware that your healthcare practitioner is aware of adrenal fatigue if you do have that, and that is commonly associated with IBS. So thank you for listening today, and we hope that you've learned something helpful. And so subscribe if you'd like to hear more great tips. Also, please like and share this video if you found this content helpful so that other people can learn from it. Remember that we're here to empower you to take control of your health.